Ladies and gentlemen, we have to start our next symposium, satellite symposium session. So I call for our sponsor from Zentiva to make the next presentation. So I think will be a very interesting presentation. So let's ask our sponsor to come in the front and to start the presentation for the Zentiva. It is in English.
Thank you. Yeah, yeah. That's why. No problem. Yeah. Okay. Okay. Good afternoon, everybody. Nice to meet you. I'm Carolina Pasero, and I belong to the R&D department of Pharmanutra, that is an Italian company producing and distributing all over the world food supplement and medical devices. Zentiva is our partners for Romania. Today, my speech will be about Chetilar, that is our innovative formulation to rapidly reduce joint pain. So we are going to see what is Chetilar. Chetilar is a topical cream. It is classified as a medical device, class 2A, and it contains CFAs that are cetylated fatty acids as the active ingredient. With this presentation, I will discuss how CFAs are absorbed through the skin, how they are effective in reducing joint, muscle, and tendon pains. But before doing that, I would like to anticipate which are the official and registered indication for using this product. Cetilar is indicated in the treatment of joint diseases, to improve joint function and movement ability, to reduce painful symptoms. It is also indicated for therapeutic messages, for the motility during period of rehabilitation. It is useful also in case of sport injuries, and it quickly reduces joint and musculoskeletal pain. As I told you, this indication are the official and registered indication for using Cetilar. So it means that they have been approved by the authority thanks to the scientific evidences that we provide. In this presentation, I will share with you some of the most important results of the scientific evidences that we have with Cetilar. But starting from the beginning, what are CFAs and how they are absorbed through the skin? CFAs, cetylated fatty acids, are fatty acids that are linked with cetyl alcohol in order to obtain the final molecule that is the cetylated fatty acid. This is just, the schematic representation of the cetylated fatty acids. From a chemical point of view, you know that fatty acids are chains of carbon atom characterized by a carboxylic group. Cetyl alcohol is as well a chain of carbon atoms characterized by an hydroxylic group. So making a cetylated fatty acid means reacting these two groups together, forming an ester in order to obtain the final molecule that is acetylated fatty acid. But which is the reason why we perform this cetylation reaction? Well, it has been proven that the cetylation significantly improves the absorption of the fatty acid through the skin. In fact, if we look which are the drivers of the absorption of the molecules in general through the skin, we know from the scientific literature that we have two main drivers. From one side, the lipophilic nature of the molecule. From the other side, the molecular weight of the molecules. The general rules approved in the scientific literature are the one you can see here. The greater are the lipophilic properties of a molecule, and the smaller is its molecular weight, the higher will be the absorption through the skin. So having a lipophilic molecule, we can be sure that it is absorbed through the skin, driven by a passive transport that is just driven by the difference of concentration. And having a small molecule like CFAs are, they are absorbed because they are under the limit of 1000, that is the limits of molecular weight that guarantees the absorption through the skin. Cetilar does not consist on a single kind of cetylated fatty acids, but rather it is characterized by a mixture of different cetylated fatty acids, the ones that you can see listed in this chart. The highly concentrated one is cetyl myristate, but together with cetyl myristate, we have also cetyl laurate, cetyl palmitate, stearate, oleate, and all the other that you can see listed in this chart. In this chart, you can see also which is the molecular weight of each one of the cetylated fatty acids in Cetilar composition. We have also calculated the mean molecular weight, that is 479. So you can see that is very well below the limits of 1000 that is the guarantee for the absorption through the skin. But how cetylated fatty acids act once they are absorbed through the skin? Well, they act through a mechanism of membrane stabilization. Membrane stabilization consists in restoring the normal concentration and the normal composition of the fatty acids that normally constitutes the membrane that have been altered by an inflammatory process. In order to well understand this mechanism, we have to do a step behind and to say that fatty acids are essential and play a key role in guaranteeing the joint movement. You know, fatty acids are the essential components of our cell membrane. And every time we have an inflammatory process that can be acute, like a sport injury, for example, or even chronic, like we have, for example, in a chronic degenerative disease, what happens? That the composition of the cell's membrane is altered because the membrane lost some components, some fatty acids that are used to trigger the inflammatory cascade. So if we are able to restore the normal composition of the membrane, we can restore also the function of the joint membrane. And it is interesting to observe that the most represented fatty acids that physiologically characterize our joint membrane are exactly the same fatty acids that we provide with Chetilar. So it is easy to understand that Chetilar acts by replacing the fatty acids of the membrane that have been lost due to the inflammatory process. This mechanism of membrane stabilization has a very important consequence, that is the pain reduction. As you know, pain is one of the main symptoms that characterize inflammatory process, and it is due to the formation of some molecules that are called inflammatory cytokines that are the inflammatory mediators formed during the inflammatory process due to the inflammatory cascade. Probably you know that the inflammatory cascade starts exactly from the fatty acids of the membrane. Every time we have an inflammation, an enzyme called phospholipases take the phospholipids of the cell membrane to be converted into arachidonic acids. Arachidonic acids then can be transformed in all the inflammatory mediators thanks to the action of two main enzymes that are cyclooxygenase and lipoxygenase. In this chart, we can see how conventional anti-inflammatory drugs act in reducing the inflammation. We have, for example, steroids that inhibits the effect of the phospholipases enzymes, or NSAIDs, like diclofenac, for example, that act by inhibiting the cyclooxygenase enzymes. If you have understood how Chetilar acts, it acts in a completely different manner through a mechanical mechanism of action at this level, stabilizing the composition of the membrane, replacing the fatty acids that have been lost due to the inflammation, and preventing the releasing of other fatty acids. So the consequence will be the reduction of the production of the inflammatory mediators. So just to summarize the mechanism of action, we have said that it is a mechanical mechanism of action that is called membrane stabilization, consisting in restoring the normal composition and the normal function of the synovial membrane. And as a consequence, the reduction of the pain thanks to the reduction of the production of the inflammatory cytokines. So the two main effects that the patient can rapidly perceive are the pain relief and the joint movement improvement. Well, in the second part of my presentation, I would like to share with you some of the most important scientific evidences that we have so far with Chetilar product. I will start from a preclinical experiment that is performed on samples of bovine synovial membrane that is very interesting to understand, which is the effect of Chetilar on synovial membrane. In this experiment, these samples of synovial membrane were subjected to a mechanical traction in order to simulate what happens, for example, during a sport injury, for example. We compared the behavior of two different samples. One was previously treated with Chetilar before the mechanical traction. The other was not treated with Chetilar. So you can easily perceive the difference in terms of the aspect of the synovial membrane after the mechanical traction. The membrane previously treated with Chetilar shows exactly the same aspect than before, demonstrating that Chetilar helps in maintaining the elasticity of the synovial membrane, whereas the not treated membrane appear completely stretched after the mechanical traction. So this property of Chetilar, or of maintaining the elasticity of synovial membrane, suggests its possible use even in prevention. For example, especially in sport athletes that are subjected to intense mechanical stress at joints level. But the use in prevention is not, of course, the only use of Cetilar. And I would say the most common and the most important use of Cetilar is in the treatment of inflammatory condition, both acute and chronic. And one of the most important example that I can share with you is the rapid effect of Cetilar cream on chronic and degenerative disease like knee osteoarthritis. I've included in this presentation this study that is one of the most important study we have about the effectiveness of Cetilar on knee osteoarthritis. That is a study published by an Italian doctor, Dr. Ariani. It was published on the journal Archives of Rheumatology in 2018. In this study, Dr. Ariani enrolled 113 patients with a condition of knee osteoarthritis, medium or moderate or quite severe condition because it was classified between the second and the third stage. And he decided to treat this condition with a very short application of Cetilar cream, 2 applications per day, once in the morning and one in the evening, for just 1 week of treatment. The doctor decided to assess the results through the WOMAC questionnaire. That is an official and validated questionnaire to assess the effectiveness for knee osteoarthritis. The questionnaire consists in some questions that the patient have to answer at the beginning and at the end of the study relating to 3 main areas: the pain, the disability, and the joint stiffness. If we look at the results, we can see how impressive they are, because in just 1 week of treatment, Cetilar was able to significantly reduce the total WOMAC score and obtaining a significant reduction in all the 3 areas of the WOMAC questionnaire, reducing the stiffness, the pain, and improving the functional limitation. So this study was the first and the best demonstration of the rapidity of the effectiveness of Cetilar, even in chronic condition. Another interesting example and another example of application of Cetilar is in the sport field. And at this purpose, I would like to show you this study performed by an Italian physiotherapist, Dr. Pampaloni, that treated with Cetilar professional hockey players with symptoms of pubalgia. Pubalgia is a difficult to treat condition that is very common in sport, like for example also in football, and it is very difficult to be treated because it is a relapsing condition. So when the patient thinks that he solved his problem and come back to play, then the symptoms appear again. So to treat this condition, this doctor decided to use 2 different Cetilar formulation, the cream and another formulation that we do have in Italy, that is Cetilar patch, a formulation that slowly releases the same active ingredient of Cetilar cream. So he treated this 10 professional hockey player with this scheme of treatment, alternating the usage of the cream and the patch. The cream was used together with the manual massage or together with the instrumental therapy. And this scheme of treatment was followed for 3 months. Also, for this study, the results are really impressive because in 3 months' time, he was able to significantly improve the muscle strength as well as to significantly reducing the pain. So another demonstration of the rapid effectiveness of Cetilar. And an interesting specification is that even if the study was 3 months long, the doctor started to observe the first good result after just 1 week of application to demonstrate once again how rapid is this active ingredient. And most important, no injuries during the 2 months of follow-up appeared. The last study that I would like to share with you is not a full paper published, but it is an interesting observational study that was presented during the National Congress of the Italian Society of Rehabilitative Medicine. And in this study, I would like to show you the possibility of using Cetilar in combination with instrumental therapy, in particular diathermy therapy. In this study, 31 patients were enrolled with different pain conditions at different level in different district of the body due to muscular tendons or joints problem. These patients were divided into 2 groups and were treated with diathermy therapy following a short or a long treatment according to the severity of their pain, consisting respectively in 5 diathermy sessions or 10 diathermy sessions. The interesting thing is that this doctor decided to associate the using of chelidar cream with diathermy therapy, applying chelidar cream with a manual massage at the end of each diathermy session. And the results were really interesting because, once again, we can demonstrate a very rapid effectiveness in reducing pain, both in the group of patients following the short treatment as well as in the patient following the long treatment. There was 77% of the patients that were able to reduce their pain by 2 points in the VAS scale, and 38% of the patients that achieved very excellent results of reducing 4 points in the VAS scale. So this study suggests an additional possibility for using chelidar in combination with diathermy therapy in order to improve the effectiveness of the instrumental therapy. To conclude my presentation, I would like to highlight the most important product characteristic. We have already discussed how the active ingredient CFAs are highly absorbed through the skin and how they are rapid in their effectiveness. Other advantages of this product, it is that the active ingredient is completely safe. So chelidar cream can be used by children, can be used by pregnant women. It gives no sunlight sensitivity, and so it can be used with no problem during summer. And this is a difference in comparison to other topical cream based on NSAIDs that are on the market. It gives no systemic side effects since the active ingredient is completely safe, and there is no risk of interaction with drugs or medication. Moreover, chelidar cream is certified PlaySure doping-free, so even professional athletes can use this product, being sure that each one of the ingredients is not included in the VADA list of the anti-doping. I thank all of you for your kind attention, and if you have questions, I am available to answer. Thank you. Yes, please. I think.
Microphone, please.
What kind of diathermy? Any kind of diathermy or tecar only?
The study I show in this presentation used tecar therapy, and I would say that most of our experience are performed with tecar therapy. But there are some physiotherapists that are using even with other kind of diathermy, but I have no data to share. So mainly, I would say tecar therapy.
Thank you. I was sure of this answer.
Thank you.
Thank you so much. So
Yes, please.
Sorry.
Thank you.
2 questions. Do you have any data about the absorption of active products? First. Second, you study the mechanism of action on in vitro synovial tissue. Okay?
Yeah.
But you have any data about, for example, the mechanism of action of in culture of chondrocytes? Because it's possible to have 2 different mechanisms of action. One mechanism due to the anti-inflammatory effects, then we study synovial membrane, but it's possible to have another action in cartilage. Sorry for my
Yes, no, thank you for your question. It's really interesting. Regarding the first question, in terms of the absorption rate, the answer is no, we don't have a precise data. If you mean a percentage or an assessment of an exact percentage of absorption rate, we don't have this data. We never calculated, and I think it's not easy to do it, because if you think on the active ingredient, they are fatty acids that are physiological components of our organism. So it's not an easy kind of measurement. Regarding the second question, the experiment that I show you is on samples of synovial membrane, and it is nowadays the only preclinical experiment we performed, but our laboratories in this moment are in the process of conducting some additional preclinical experiment exactly on chondrocytes that are the cells, of as you said, of the cartilage, because of course there is also an improvement in the cartilage health, but for the moment we don't have data to share. Hopefully in the next future. Thank you.
Thank you very much. We also have the next session to start. So if
Thank you.
There are no other questions, thank you so much. And now I will invite Professor Francisco Maraver and Professor Jose Carbajo to join me for the next session. Professor Maraver. Thank you. Do you prefer? Yeah. Yeah, okay. Carla is speaking. Carla is speaking. And you presenting all the time.
I will ask my colleagues to be prepared for changing the presentations. So I think we can start the next session. I'm here with Professor Francisco Maraver and Professor Jose Carbajo from Spain, and I will present the first speaker, the first paper, Situation of Medical Hydrology in Spain. The speaker will be Carla Morel. Okay, thank you so much.
Good afternoon to everyone. And first of all, thank you very much to the organization, to Professor Constantine, for all his ability for coming for all the Spanish group here to Romania. We are very happy to be here. So I'm going to present how is the situation of medical hydrology in Spain in the last 5 years, as you know, since 2020, the pandemic situation, how has been the evolution since that. This is the situation before COVID-19, which was in 2019, which 119 spas in Spain all over, with an invoicing of 255,000 million of business. So a very, I think that it was in a good situation with workers, customers, overnight stays. And this is what's happening after 2020. You can see there that this was in 2019, and this was programmed as well for 2020. But at the end, of course, because of the pandemic, this was the situation about the number of tourists, of spa users. This on 2021 was slightly worse. Obviously, this was in the first trimester of the year, no, since March. This was in 2021. And in 2022, we are starting to recover. This is absolutely, you can see here very graphically how it was during these 2 years and how we are recovering from that situation. It still is not on the previous situation. Some of the spas has closed, and a lot of doctors moved from working to the spas to the hospital or sanitary centers, which was necessary in that period. This is the situation. This is in 2017. How was here? You can see all the medical specialties, which doctors have more than 55 years. This was in 2017. So now you can add here these 8 years. So medical hydrology, the balneologist, was here in the 7th position. In almost 55% of the medical professionals was more than 25 years old. So it is the situation also in other specialties, also in general practitioners. We have the same problem in Spain, lack of doctors in Spain in general, but you can see in all the specialties which the people there is no this renovation of professionals, especially in medical hydrology. So what has been the adaptation that we have been for this situation? No? What happened in Spain? The first of all is the adaptation of the social and healthcare programs and the services offered. After the pandemic, we learned that the same as always, the same that we did previously, maybe is not enough. So the spas are working in offer different things, other opportunities of treatment. And we are going to give the example of the treatment in a very known spa in Spain, in Cofrentes, in Valencia, which here you have the basic that we used to do in our spas. For example, the treatment of the chronic pain and to enhance the muscular and all the physiotherapies, the balneotherapies, and we add this healthy lifestyle this is maybe in France and in other countries, this was from the beginning, but in Spain, it has been afterwards. It was not from the beginning, this kind of schools of a healthy life. And there is now this kind of other part, which is this prevention situation and this longevity plan, which is a little bit like this morning, Professor Rox explained about fragility, pre-fragility, and robustity. Make this plan in the more or less in the same way he explained. So this is the treatments that I told you. This was balneotherapy, physiotherapy, pain treatment, and another, in this case, new treatments that we add to the basic ones: prevention, a longevity plan, healthy and therapeutic exercise, which needs the continuity of the spa. Normally, in the previous times in our spa was this 14 days of treatment, and then since the next one, and now this kind of continuation of the treatment at home. Health education as a new pillar of the treatment in Spain. The education was based on conferences, courses, workshops about postural hygienic, physiology of chronic pain, and also in this kind of pillars like nutrition, physical activity, sleep, rest and relaxation, emotional health, cognitive health prevention, this kind of primary and secondary, learn how the spas as the best in primary care centers. A lot of times it's not possible to do this kind of workshops and lectures to the patients, and maybe the spa is the perfect place to show our patients how to do it. And this longevity plan, which is something very specific of this spa in Cofrentes, which developed this Rosita APP project, which is well, it was like this longevity plan for home. Is a app that you can see on your app store, Rosita, which is how to modulate or how to continue this exercise and this lifestyle after at home. This is a spin-off, which people of Cofrentes maybe later will explain us a little bit more. And this is one thing, the specialization of the spas in another things. And the other very important for us was the training as Complutense University of Madrid. How was the training of healthcare professionals? This was this morning, Professor Cantista was the same slide, how it was in 2010, Italy, Spain, and Turkey as an independent specialty. But we have to tell you that since 2022, so 2 years ago, it was finished. The government asked all the specialties that they had to stop this kind of medical professional schools and go to the internships, MIR, which we call the MIR program, the internships that we have as any other specialty. So you have to be 4 years in a hospital, training, or in primary care as other specialties. Of course, as a medical hydrology, this has not been possible in Spain. So now we are in a situation that we are trying to move from this to here, to a competency like other countries in our area. And in these 2 years, no other specialty has already done this move to the competency. So we are in this 2 years lack of period that we have to transform our education from here to here. These are the countries like in Romania, we know, which is with the medical, physical and medical rehabilitation, and this is the countries where they don't, all these Anglo-Saxon countries, which is not a competition or qualification. Sometimes they don't have not even sound of what it is. And the good news, this is probably the bad news from the speech today, but the good news was the situation about the consolidation of research groups. This is made by the universities. You can see 1, 2, 3, 4, 5, 6, 7 universities, which are active. I could say you active in publishing relevant investigations. I will just show you in these last 4 years, which the other things has not grown the same. But I think that in the part of universities, we have the contrary. We can be in the other part. For instance, Complutense University de Madrid, which probably you know, which is more huge research and investigators. This is the Vademecum. The Vademecum is done to all the active spas in Spain every every 5 years, and then every spa doctor actualize there for what is using, which are the techniques, and you can see the active spas, which the specialization and the techniques that you can find, and also all the research published. This is published in 2021 about the pelotherapy as a thermotherapy agents. Also, you know that in Complutense, it's a huge important part, all the physiotherapy and chemistry of peloids. And this was published this year about the biophysical effects of natural peloids of normal skin. Also, in 2020, we published about in people with a stroke and stroke patients in a thalassotherapy center, 2 weeks program. This was a clinical, not controlled, non-randomized research. And then we have also some experimental studies about how the sodium chloride-rich mineral water can change intestinal epithelium because with this research, we proved that after the treatment, after the spa treatment, after these 12, 14 years at the spa, you can still have all the improvements that you take because of these changes of the intestinal epithelium that you can see with this drinking therapy. Then we have also in this line that you saw the prevalence of frailty, prefality, and geriatric symptoms in people in Cofrentes. Also, you will see, you will hear afterwards more things about Cofrentes. And also, this is from Brazil, also a collaboration from some other countries in Spain, France, Italy, and Portugal about the comparative analysis of balneotherapy. Then you can see the group of La Coruña, which also Professora Fioravanti explained this morning, which have a very particular group, which is doing many basic experimental research with animals and these hydrogen sulfide effects with these 2 papers also in the last 4 years. Then we have the group of Vigo, the Professor Legido, la Professora Lourdes Morel, which is also here and will tell us about only the last published. They study how these microalga peloids and the use in wellness and also in cosmetic purpose. Also, these peloids related with thalassotherapy and the skin, which has been after radiotherapy and treatments of breast cancer. And also the hydrobiome of thermal waters and the use in dermocosmetics. Then we have the group of Extremadura, which is led with the Professor Eduardo Ortega and also Antonella Fioravante is involved in this research, which they study the mechanism. This is a professor of physiology, and then they study the mechanism of action of the balneotherapy in rheumatic diseases, how it affects on the immune system, serotonin, dopamine, and also the systematic review. And then we have in Almeria, this is a nurse professor, which makes some publications. This is the last one about aquatic therapy. She studies the aquatic therapy program, which is, you know, a little bit different from balneotherapy. This in case, but it has other publication on osteoarthritis, but this was in chronic stroke patients. And then we have the group of Granada, very, very specialized on peloids, where we have Professor Rafael Delgado in Granada. Also, this is the University of Sevilla. I think Professora Carretero also specializes in peloids, and I think that this is a must. All people interested in peloids and the physicochemistry particularities of peloids. We have this review part 1 and part 2, also by Professor Carretero of Sevilla. And last but not least, this huge collaboration with afterwards, Professor Morel will tell probably about this huge collaboration between different universities in Spain, also in France, about which is now the artificial intelligence, which we have also learned a little bit in the previous lecture. So in conclusions, we are coming from a difficult situation. Spain for these 4 years have really affected to the functioning of spas in all ways, in the thermal programs, on the health programs, and also in all the wellness programs. And the spas are moving to new indications, alternative treatments, alternative possibilities. Also, training and health professionals is also a period of change, because this moving to the specialty to a competency, which now from the Medical Spanish Society, we have to work to be able to do it in the better way, or probably also with this European level relation. And the consolidation, I can say, of research group in health resort medicine all over Spain. And that's all. Thank you very much.
Keep the discussions up to the end of the session, so we'll have all the discussions at the end. And I will invite the next speaker, Professor Jose Carbajo, to have a presentation about climate, mineral waters, and peloid of the Pink Lagoon of Torrevieja, if I say it correctly, Alicante, Spain, and its potential use in thalassotherapy. Professor Jose Carbajo, please also tell all the team of the work. Thank you so much.
Thank you. At the beginning, you can hear me. Yeah, fine. At the beginning, it's a pleasure for us to stay here with our friend from Romania. We are all the Spanish people. We are closely to the Roman people. For that, I have mentioned to Olga Sorbis, a friend, and Constantine Monteano. I'm going to say we haven't seen. We are speaking about the climate, water, and peloid of the Pican Lagoon of Torrevieja, Alicante, Spain. Its potential use in thalassotherapy. This is the location of the pink lagoon of Torrevieja in the southeast of Spain, in the central area between Alicante, we are here, Murcia, Cartagena, and Mar Menor. We have it, the complex of the lagoons. In the central area of this, the center of the Pink Lagoon, there is a salt production factory. We can see in this part. This is to collect the salt of the lagoon, and is connected to the La Mata Lagoon, is the green lagoon you can see next to the Pink Lagoon. La Mata Lagoon is connected to the sea by a channel that allows to entry the seawater, and both lagoons are connected to each other by the La Salina channel. Here we have it. And so the Pink Lagoon receives saline water from the La Mata Lagoon. Here we have it, the canal, and receive brine from a salt wash from a deer pier in Cabezo de la Sal mine. Here we have it 54 kilometers from the deer pier to the lagoon through a brine pipeline. To a brine pipeline, with the consequence of this result of an ancient work of engineering, a Pink Lagoon, due to its environment condition. People usually go to take brine bath, and it's curious to see that in the border of the lake, there are vegetation adapted to the high concentration of salt in the lagoon. In other sense, we study the environmental climatology of the area in the last 50 years in the lagoon. I repeat it, 50 years in the lagoon. We take the data on association of meteorology on the area and the meteorological agency from Spain. As you must intuit, it's very pleasant for the human beings. Its temperature. We have in red the maximum temperature around the year, and in blue line the minimum temperature and the average. We have a temperature minimum at 7 degrees in winter, and the maximum at 30 degrees in summer. We have a minimum 10 hours of daylight hours. And in summer we have 15 hours of light, with a lot of shortwave solar energy. And the 60% of days of the year, at minimum, are clear sky. We have no clouds. We have no precipitation days, only 4 or 5 days in October, but all the year have no precipitation. And the amount of rainfall is very thin. Only now, again, in October, we have 30 liters in the month. And we have a very soft wind speed, and we have a little problem. We have a very high relative humidity. These parameters make Torrevieja, in our opinion, an ideal place to receive thalassotherapy treatment, and we obtain the bioclimatic diagram of Torrevieja and compare with the comfort area of Olgay. Olgay was an architect of Hungarian origin who set the standard for human comfort based at the beginning on temperature and humidity. Here you have in a red line the discomfort heat. Upper this line, you are discomfort your body with heat or temperature. And you have a blue line. About this line, you have a discomfort by cold. Naturally, the orange line is the ideal comfort for the body. And here is the Olgay comfort zone. In pink, the line of 15 color represent all the months of Torrevieja. As you can see, only the month of August was without comfort for the body, while July, September, and October, why not? Due to the high relative humidity, not for the temperature. It's a question from humidity. We decided to take water samples in the center of the lake, around its perimeter. We have the Professor Marvel in a 2-year tip, imagine, and around its perimeter. We didn't find any appreciable difference. It was more difficult for us when we tried to take some sample of the peloi. Here is the Professor Armijo, Professor Maraver, and Javier Mínguez is our angel, like we like to see, from the town hall of Torrevieja. Javier bring us the faculty to move with all the liberty for the area. It was more difficult when we tried to take some samples of the peloi. It was impossible in the lagoon because the peloi was diluted, and it was impossible to collect it in the dry areas. It was also impossible because regardless of the dangers of the sulfate that cut our feet, we need to put a special socks because it's like a glass, the surface. The ground was extremely hard, making it impossible to collect with manual means. So we decided to take the sample on the vegetal areas on the lagoon's border, where the people usually collect and put them out on their skin. It's the knowledge, the popular knowledge at the end is the right. The composition of the water allows us to affirm that is an hypothermal hot water with a high conductivity and dry residue, very, very high, with a pH close to neutrality, and is very rich in sodium chloride and magnesium chloride. And in addition, have sulfate and carbonate, mainly from calcium. And why the pink color of the lagoon is not for the composition of water. It is due to the phenomenon called evaporite. To generate this phenomenon, high solar radiation is needed, we have it. High temperature is needed, we have it too. high concentration of salt is necessary and pH close to neutrality. We have it too. And in addition, you need other conditions. A very thin layer of water. In this situation, the water evaporation originate an ordinary precipitation minerals. First one from carbonate, like calcita and dolomite. After that, when the evaporation of water is around 80%, we have a precipitation of sulfate, like gypsum and anhydrite. And finally, when the evaporation of water is very high, around 90% of water, we have the precipitation of sodium chloride and magnesium chloride. Originating on the silk surface, an ideal medium for growing aerobic microorganisms and an oxygen-free environment inside the mud for growing saline anaerobic microbiota. What kind of microbiota? We have 4 types of microorganisms we found in the extremely allophilic water, like us. We have more than 250 grams per kilogram of water, of salt per kilogram of water. We have the archaea, bacteria, eukaryota, and allovirus domains. The anaerobic archaea and bacteria can produce a red-pink pigment with more antioxidant power than beta-carotene. We have there bacteriopruberine, bacteriorhodopsin, salinidin, xanthin, and a retinal pigment like xanthorhodopsin with high antioxidant power than beta-carotene. In eukaryotic domains, we have Dunaliella species, especially the Dunaliella salina, as a microalga, also produce very beneficial elements for the skin, beta-carotenes, colorless carotenoids, and vitamin B12, with antibacterial properties, antimicrobial properties, and antioxidant properties. Contrary, no property have yet found for virus infestation. The infestation of virus is mainly made in archaea. This microbiota has protective properties against microbial contamination, protect the immune system, and improve the chemical and physical barrier of the skin. Like an anecdote, flamingo birds know perfectly well the properties of the microbiota and use it for like food, causing the pink color in the plumage in the wing. Peloids has a low water content with an solid radio around 0.74, which indicated a solid phase of inorganic materials, similar to the Dead Sea and Lopagan peloid. Lopagan is in Spain too. In this comparison of properties, you can see the red color is the less punctuation, and in blue color, the maximum punctuation in comparison with another lake around the world. We have a lake from Romania, Ursu, too. Pelois has, the samples have two granulometries, one between 1 to 10, and another one between 10 to 50. The average of the sample being around 4. It's a very little particle size. And the reaction time indicate that the product gives off the heat very quickly. So good for this question. It also has a low heat capacity due to its small concentration of water, which also provides a small value in the thermal retentivity. Similar to Lopagan, Sorkol, and Aralsol. The texture results show us that the peloid is not very hard and has low adhesiveness. And for this question, is not the ideal peloid to put on the skin. And for that, we have this conclusion. Respect to the mineral water, it has a therapeutic potential, like Ursu in Romania and other places around the world. The respect to the peloid, due to its low water content, hardness, and low adhesiveness, it should be applied with a brush, like the Egyptian style, or with a massage. Due to composition and microbial law are excellent antiseptic and antioxidant properties. And for this question, we think have good properties from desquamation problem of the skin in the dermatological area, like psoriasis, atopic dermatitis, neurodermatitis, etc., in oral mucosal lesion, and in rheumatic processes. A final conclusion, we need to say climate, water, and its peloid make the Pink Lagoon a perfect place, in our opinion, to put there a thalassotherapeutic center. And the therapeutic properties of each element must be verified with the corresponding clinical study. We end with a top view in summer. It's a lovely view of top view images from the Pink Lagoon salt factory when they collect the salt with the ship and the barges where the salt is collected and is transported to the factory to process it in the border of the lake. That's all. Thank you for your attention. I have a problem with this.
Okay, you are not a good angel.
Okay. Hola.
Okay, so we invite the next speaker, Lorena Vela, to have the next presentation. The group of authors, Lorena Vela, Miguel Ángel Fernández Torán, Clara Fernández Porta, and Francisco Maravel, Health Resort Medicines as a place to detect pre-frailty and frailty in elderly people.
Hello. Thank you, the scientific committee, to permit me present this work. We are a group in hydrology medicine in Complutense de Madrid. We have and research with the Cofrentes SPA, and I will present health resort medicine as a place to detect pre-frailty and frailty in elderly people. The aims of this presentation is demonstrate that health resort medicine as ideal environment for detecting fragility and syndromes in older adults. The benefit of the thermal environment in treating and preventing dependence is very important. We do a study, not controlled, prospective study design to measure cognitive, movement, autonomy, nutritional state, and psycho-emotional areas in elderly. When we think about aging, we know that it's a natural process that begins about physiological change in the human body. The change results in a decrease in functional reserve and limit the capacity to respond to external factors. It's very important understanding that this physiological change is crucial in addressing the unique healthcare needs of older adults. Main concept. Today in the morning, Professor Roque speak about this. Frailty, pre-frailty, and robustness. The frailty consists of a loss of homeostatic balance, leading to a state of vulnerability, predominantly because of aging. Those considered frail are the higher risk not only of mortality, they have serious adverse events like hospitalization, falls, and of course, increase the risk of developing dependency. And those who are pre-frailty are also the higher risk of become frailty in 3 years and have a great risk of mortality than those who are robust. The good thing that is pre-frailty is a reversible state. Yeah, that is a very important date. It's very important that know that a typical disease presentation in elderly because they have a lot of symptoms, and it's important. Another thing is the geriatric syndromes and their consequence. We have to know that the geriatric syndromes are generate greater morbidity, and it's important to detect that symptoms in a clinical history elderly patient, and we have to need the time for prevention, diagnosis, treatment, and improving our health and well-being. Well, so we ask in the group what is published now about health resort medicine and healthy aging. Okay, today we saw this. It's important said that a group in France, in Marie-Luc, they study combining balneotherapy and health promotion to promote active and healthy aging. This was in 2016. They published this work, benefits of a 3-week outpatient balneotherapy program on patient-reported outcomes. They analysis of the health profiles and prevalence of falls for patients over 25 years old of age in thermal environment. This was 2019. And the group of Montpellier in 2022 present this work, very good work, identify frailty and thermal spa, a clinical setting, a cross-sectional study. And in Japan, a very good study of bathing frequency and onset of functional disability among Japanese older people, a prospective 3 years cohort study from the gauge. So with the group, work with Cofrentes. Cofrentes is a spa school of longevity, and they develop a special app, Rosita Longevity app. Yes, this app is for the patient who goes to the thermal center and continue the treatment of education and exercise in home. So Cofrentes is an umbrella organization, interconnection, yes, that prevention, healthcare, cure, and active independent living of elderly people. The team has a vision that prevention and management of disease are essential to promote active and healthy people. Each year, 10,000 patients go 10 days program and combines balneotherapy and sub-activities that include fall prevention initiative, the prevention of frailty, chronic respiratory disease, chronic disease with multimorbidity, inactive disabilities, and promote independent living. Okay, something curious. I asked to the AI, how is the thermal center in elderly? Okay, they create this image. You know why? Because the physician hydrology, we don't use AI. She don't know anything about hydrology medicine because we don't use. So she only could put a person or people, water, and nothing more. It's a curious date, and I want to show you. Okay, but what is the real life in Cofrentes? We are very active thermal center. We use hydrotherapy, we use paraffin, we factory, we use paraffin for treat education programs. We use inhalations, cure with water, and it's important to say that is a very important thermal center in Valencia. And we use a program with physicians, with physiotherapists, genetic study, nutrition, and the app Rosita Longevity. So in 2022, we asked, okay, what is happening? There are frailty people in our patient, and we made this study. This was a pilot study. We published this in the in Balneo and research from the group of Dr. And they accept our work. And we found that the half of the people older than 60 who visit Cofrentes spa presently function deficit condition. Women present a lower quality of life than men. The more affected items in the profile population were grip strength and physical activity. Health resort medicine is an ideal place to detect this aspect. And now we win a grant for develop an engineer system, and we are in a project research, and we underway to explore the potential of spa as ideal environment for detecting the state of frailty, prefaith, and robust in older adults. The aim is to identify shared syndromes prevalent in elderly population and determine the evolution after 1 year of performing the thermal cure and offer patients the use of a specific app for home training for the elderly. A longitudinal prospective observational study has been designed to measure the different spheres affected by the agent: cognitive function, movement, autonomy, daily, nutritional state, physico-emotional well-being, international validated scale are used to assist the robust prefaith and faith of the patients. We evaluate the group when attend 2023 to the Cofrentes spa, and we will be the measure in this year when they come back. We study biometric recording, movement analysis, and evaluation of biomarkers with image using resonant magnet. We are doing a very big study observational, Bartel scale, Lofton scale, Linda Frey, weight loss, Minnesota scale, insomnia, international physical with IPAC, gait speed, palmar grip, balance, endurance, leg strength with motor coordination, ECOP, Pfeiffer, Yestavach, short mini nutritional assessment, FAC, SHARC, quality of life, number of falls in the last 12 months, number of hospital admissions, number of emergency room visits, number of unscheduled visits to primary care, muscular or joint injuries in the last 12 months, neurocognitive system, anthropometric measure, lung capacity measure, multi-frequency bioimpedance, abdominal circumference, right edge photograph, right hand photograph, profile and frontal photograph, face photograph, self-perception, health survey. We're a big, very big group of engineers. They are who are thinking about this because we have a special equipe there. We install it in our gymnasium, and we film all the movement of our patients, and later we analyze. And this is the REM, the resonant magnetic, and is very is for only not big articulation, and we use this imaging that is not a good image, but we use AI for analyze. And so we are in progress, and big data analysis is important in this case. And we will use processing and statistical analysis of the data, the R programming language version 4.1.3 will be used for the analysis of the main objective and analysis of the reversal of Rayleigh will be carried out using the Kaplan-Meier technique. Likewise, the hazard ratio of the reversal of Rayleigh will be calculated using a Cox regression, using as confounding variables those considered as such in the analysis, and of the operation of the randomization and those that, in the opinion of the researchers, present relevant clinical importance. This is for us very important now. And okay, conclusion. This is the second image that could create the AI when I said resource health thermal and aging. And I think that only have some idea from Asia, nothing more, not European. She couldn't create nothing from Europe thing. And conclusions. Systematic detection of geriatric syndromes ultimately improves the overall well-being and quality of life for older individuals, as it enables healthcare professionals to provide appropriate intervention and support. The thermal response provides an ideal setting for the treatment and rehabilitation of geriatric syndrome. The therapeutic benefits of thermal treatments combined with education programs and exercise play a vital role in preventing dependence and promoting healthy aging. Future and further research in this field are important. Okay, thank you very much. It's important to say that this is financial from the Valencian Innovation Agency, and it's a program for develop technological, not for medical study, but we will use this for that. Thank you very much. I am a question.
See? Good afternoon. Yeah, that's right. Thank you very much.
The next,
I'm sorry.
the next lecture is from the Vigo University Group. It's presented by Maria Lourdes Murray. She's a pharmacist like me, and she worked in the education area like me too. We know from the cosmetic, the old time of cosmetic product, and now we are here. She is a real specialist in the area of algae and the sea. When you want.
Thank you very much to the organization and the scientific committee for accepting this presentation. And well, this is true. I am a former teacher, yeah, but I am involved in this group, you can see here, in this research group since the 2000, more or less. So we started working on the field of peloids with Dr. Legido, that is the head of our group. I am not a specialist on peloids, in fact, but you can see our research. We are a big group, but within this big group, there are some people that work in the field of peloids and thermalism. Very few people, but we have a very good colleagues, as you see before, in Spain, and we collaborate a lot with University of Complutense. We work with Dr. Mejida as well sometimes. So as you can see, we are a very strong group, close each other, and I am very happy to be here because this is a dream for those people who work in the field of peloids. For me,
It is a dream, and I am very happy to be here. And thank you very much to Simona that explains me everything. Thank you very much, Constantine, and all the team. Thank you very much. So I start with the presentation. Let me go back to the background of this project, because this is in collaboration, as you can see here. These two people are the owners. They run a thermal spa in Extremadura, in Spain, the south of Spain, Balneario El Raposo. And this collaboration started about 6 years ago because they had a natural pelloid that is a bit strange, is made, or it appears when the thermal water goes to the land. They have a big piece of land around the thermal spa. But the pharmacist that was in charge of quality control said that it's not very well performed. So we started a collaboration to develop a new pelloid. We call that technological pelloid. So during the last 5 years, we developed together a new pelloid. After that, Dr. Ortega, that has been mentioned here, Eduardo Ortega from the University of Extremadura, the group is immunology, yes, immunology. They start working as well with El Raposo and University of Vigo, in this case, to evaluate the effects of the pelloid in osteoarthritis. So, as you can see, we are a multidisciplinary group, yes? So, this is the last part. We had 5 projects. This last one, it was an idea I had years ago. Why? To add essential oils. One, because this thermal spa has a big land where they grow herbs to sell as herbs for chamomile, thyme, and so on. But the first idea was to add these essential oils and these herbs to an important cold meat factories that are working around this area in Extremadura. Yeah. So after that, I said, okay, if you are going growing herbs, we can use the essential oils, add the essential oils to the pelloid, and see if it works better or not. So we are in this point, okay? So here you can see this project. First of all, they perform an agronomic management, so they add more water to some fields, they add more biofertilizers to some fields, and they evaluate if the plants, sage, rosemary, oregano, yes, several plants, if they grow better or not. This was the first part. After that, we started the rosmarinic, well, first of all, the essential oils. Yes. After that, we calculate how much rosmarinic acid had each plant, yeah, each herb. This is another part. And then we formulate a pelloid, a new pelloid. The former pelloid, the very beginning pelloid was thermal water plus a kind of silky clay, yes? The second pelloid was the earth or the silky clay plus water plus microalgae. We decided to study the microalgae from the thermal water, and we found very strange species you are going to see next. So we decided to grow this microalgae, yeah, grow the microalgae, and now they prepare the peloid in a big basin. You can say they basin, yes, big pool. Yep. The earth, the water, the microalgae, and they mix together, and with a period of maturation. Okay. So next step was adding the rosmarinic acid. I need to explain all that because if not, it's strange. The final project is to validate the results, compare the former peloid with the new peloid with rosmarinic acid, essential oils, and to see if the behavior is the same or not. And this is the part that University of Extremadura is performing now. They are finishing now with that, and they will publish that very soon. Yeah. So yeah, we are in this part. So we decided our job is to study from later, but to study the thermophysical properties in order to see if the peloid is suitable for thermotherapeutical applications. And also we study, as other groups in Spain and Italy and so on, if the period of maturation should be 1 month, 2 months, 3 months, how long? In general, 1 month is enough. The thermophysical properties don't change after 1 month. And this is the average. So for that, for this study, to study the thermophysical properties, we use the peloid, the Monaraphidium pusillum. I'm sorry, for me it's very difficult to pronounce this now. Yeah, we identify this species, and we add the rosmarinic acid. At the very beginning, we add a commercial rosmarinic acid because we have to test which is going to happen. But now we add the rosmarinic acid from the herbs. And I must mention that the herb who has more content on rosmarinic acid is thyme. No rosemary. Thyme. It's amazing, but I suppose it depends on the feel and the environment, the sunlight, the many different things. It's thyme, not rosemary. It's amazing. Yeah. So then we perform that I mentioned before. We mix El Raposo silty clay with the mineral water, and then we add 1% of microalgae grow in bioreactors. They have all this technology there because it was a previous project, as I told you. We mix that and we study the peloid at room temperature, a maturation period for 7 days, 15 days, 30 days, 50 days, 90 days, and a 35 degrees too. So room temperature and 35 degrees. And when we add the rosmarinic acid, we use different doses. 0.5, 1% and 2%, and we study all these experimental peloids. So we use very quickly pygnometry, as everybody knows, a Calvet calorimeter. I told that it works very well. The carbon prothermal properties analyzed for thermal conductivity. Well, I didn't say that the calorimetry is for a specific heat. And then also a kind of rheological study with a physical hemisphere Anton Park, mostly to see if to test the spreadability, if the peloid CC2 applied, because in this thermal spa, they use the method that Dr. José mentioned, yeah, the Egyptian method. They apply the peloid with a brush in a very thin layer and then heat.
it. Okay, this is the typical application from the beginning of the last century. They have been doing that for years. And then we calculate the thermal diffusivity to see, as usual, if the heat remains or not, or diffuse very quickly. And here we can see the density versus the maturation days. This is normal because it loses water. Yeah, but with the rosmarinic acid doesn't change a lot. There is no big changes. The specific heat the same. After 1 month, there are no changes. With the rosmarinic acid decreases a bit, but slightly, not very important. Thermal conductivity, the same. After a month, there are no changes. With rosmarinic acid, it's more or less the same, no changes. Not appreciable changes. Well, and then the thermal conductivity. And this is more or less the same. After a month, there are no changes. It increases a bit with rosmarinic acid. This is not good, but the differences are not very high. We can see the results of testing biomarkers that is performed by Dr. Ortega. You have to see that. And then the modulus of elasticity of viscosity is more or less the same. We see that with the small deformations, the elasticity is better than the modulus of in fact, is the elasticity versus viscosity. So for, you know, that I try to mean, because I'm not a specialist. David know this, he could explain better than me that. But when you spread, you need to spreadability. So this is a thin layer, so it's easier to spread. If the treatment were by plasters or, how do you say, cataplasmas, could be the problem. But in this case, no. So, well, to summarize, we analyze the different thermal properties, thermal retentivity, specific heat density, and so on. We also perform a rheological study. We concluded that the pelloids are suitable for pelloid therapy application, and the optimum pelloid contains 0.5% of rosmarinic acid. This is the best after this investigation, and the maturation time is enough with a month. So it doesn't deserve to waste time and money to enlarge the maturation. So we think in our group, we think that each pelloid should be studied in order to determine the exactly time of maturation. Because we know that in some places, the maturation could be one, well, in Boí, for example, yeah? Everybody knows Boí because it was there were a very good Congress on pelloids, and it's 1 year and a half. We have to evaluate that, I think, in our opinion, in our group. So thank you very much for your attention.
I only ask you to use the microphone. How I call it. I enjoy it. I will have some presentation. It's important. You can read this.
Yeah, yeah, you can hear me?
Yeah.
I need to say, fortunately, only a few molecules go inside the skin. Fortunately, if the salt or the prescription we can see after a moment go inside to the body, we have a problem. Because when we go to the sea, take a bath, after that, when we go out, we are like Michelin figure. And for that, the mechanism, we have the reflection of that, we have in a group, we think so, and we propose different mechanisms from some molecule specialists, the molecules who are polar, like salt. It's impossible to trespass, to go inside the skin with the different layers. Our skin is designed to don't permit to enter any substance. For that, the receptor, the concentration of the different cells and salinity make the osmosis process and different question make some signals to the body, to the endocrine, to the nervous system, or other type of mechanism, and send the order to make a training in our own body. But only two molecules are clearly trespass our sodium column at the minimum. One is hydrogen sulfide, and the other one is CO2, carbon dioxide. Because our gases, that's the only reason. And we can found hydrogen sulfide in your blood if you put it on the skin. Consequence, the main consequence, you can see. We work in other times with Chiclana Balnearium in my province in the south of Spain, and have the capacity to measure, thank you, to measure the blood flow with a laser, with a Doppler laser. And we put it the one hand in the sulfurous mineral waters and the other hand in tap water. And the difference of circulation is very, very high. It's 3 or 4 times more. And that's only for a question. Hydrogen sulfide go across the skin, and you can find it on the blood. That's the real situation. All the things with different molecules.
But also the pH is also quite important.
Essential.
Essential, yeah.
It's essential.
Always I cite your paper related to the hydrogen sulfide going to the skin, so.
The ability to go inside is like a gas. And for this question, the pH needed less than 6. I don't remember exactly the figure, but less than 6, the pH. Between 6 and 8, I remember, I have in my mind, is like an onion. And the capacity to go inside the skin is less. More than 8. No, you have any possibility to go to the skin. Yes, a bipolar molecule and it's impossible to trespass the skin. And for that question, you need hydrogen sulfide, more than 25 per milligram per liter, and in condition of pH, you don't have this condition. Hydrogen sulfide is have no properties.
I don't think I saw when we are speaking about mineral waters with hydrogen sulfide, also very clear this parameter, the pH. Maybe now it is better to correlate
It's
these
essential.
parameters.
It's
Yeah.
essential. And for in the other way, remember this morning some people are explaining. I think for is Cristiano about the piezo channel. You speaking this morning about the piezo channel? No. Speak about the piezo channel. Yes, this is another mechanism. Ions no trespass the skin. The ion have an osmotic process from the cell, and the cell set an order to the different kind of organism, nervous system, blood flow to the endocrine system, and the order is making by the salt, or the quality of salt, or the quantity of salt, but the salt don't trespass the skin. The professor said, the right position, more than 5 milligrams per liter. 5 grams per liter from chloride. And for this question, we need to study some mechanism, because the scientific world don't understand us if we don't put it on the table this data, because it's scientific fiction to say this is wonderful, that it transpires the kingdom. That's true. That's false. That's not.
Another very interesting topics I heard also during your presentation, but also in the morning, also in the presentation of Professor Zeki Karagule, was about microbiota. I think it is another very interesting direction of studies, because I didn't hear so many times this terminology, and maybe it's quite new, let's say, in the science, the hydromicrobiology, the hydromicrobiota.
I think that the word is made in Seki. I don't know this word. It's for me it's new.
Okay.
But it's, I think it's a very.
Okay, please. Only to the microphone. Our colleagues and there are also many, about 40 colleagues from OR online. So
This war started when, after the project for human microbiome, 2008, people started, researchers started working on the different microbiome on our body, but also they started studying in the soil, in the water a little bit, not a lot. So during the last year, we started speaking about that and say, started, because we started with our project that is going to present on Saturday. Yes, we started speaking about the hydrobiome to explain that is the microbiome inside the wood. So this is a new word we invented.
yeah, because I know all the bulletins, all the analysis for the mineral waters here in Romania, they have to be tested at each 5 years. And they make all the microbiological analysis for sure, because they have to check for pathological microorganisms, but never I hear the term hydrobiota.
This is the idea. The idea is to study not only the bad microorganisms, but the good ones. And the Italian people is very good on that.
so the microphone.
The fellow
Very interesting. So, yeah.
Yes, the study of the microbiome is opening a new page in medicine. Of course, we know since a lot of years the importance of the microbiome in the intestine. But we know also the importance of the microbiome on the skin, in the bladder, and in the upper respiratory and inner respiratory. Every part of our body lives with necessary microbiome. And for the water, it's the same. We have the germ who produce infections, which are not good for people and that are determined by the usual bacterial analysis. But the microbiome is not made of pathogens. It's made of useful bacteria. And these bacteria were very difficult to identify. And when the microbiologist had only microbiological techniques, they had great difficulties to identify this microbiome. They use mainly the techniques of co-culture of amines to identify a new bacteria. And it was found a lot of such bacteria in the waters, and particularly in the thermomineral waters. But with the genetic techniques today, it's very easy, it's more easy to identify. And I think that in the next years, we will have to cope with the disturbances of the microbiome in the human tissues and with the microbiome from the medicinal water. And this will be, in my opinion, a very interesting,
Very good direction of
challenge. I hope to become sufficiently old to see it.
Tomorrow morning, we have presentation on peloids, and this, in this sense,
will be also a subject.
in this sense, because we can obtain the microbiota from the water or from the soil. And you need to have be careful, because in the soil we have a lot of things, you know, and with contamination and the moderation process.
The microbiome of the soil is streptomycin, because if you remember, Salman Waxman had the fundamental idea that all the bacteria of the human and animal went into the soil, and most of the soil were not contaminated anymore, human or animal. So there was in the soil substance or
Another component?
Antibiotic substance, yes.
or other systems who were putting at rest the bacteria. And they internalized during about 30 years the soils of all over the world, and they finished to identify Streptomyces. And Streptomyces gave streptomycin. Streptomycin made tuberculosis a non-fatal disease. And on the other side, we have the discovery by serendipity, which was the discovery of penicillin by the genial observation of an error of a laborantine in a laboratory in Great Britain.
Thank you very much for all the comments. If there are other questions from the audience, if not, we use it all the time. Thank you so much. So I give you the microphone to close the session.
Thank you. Thank you for your attention, and I think it's this debate is very important for us, and to clear some concept we need to change. And I have Antolena is not here, but morning we speaking about the age of the people who speak here. By me, we always are the same. We need young people to renew this area. And for this question, I think in the future, the Romanian people are the leaders of the hydrology. You have 250 people in all of your Congress. And for this question, I need to say you congratulations.
Our rate of half an hour. I know from the Spanish delegation that we need a room. The room B is available for this half an hour. In fact, all the day, the room B is available for meetings. If anybody wants to have meetings during this Congress, the room B is available. We can meet together there. And also, I have to mention that the welcome networking cocktail will be in the same room where we have the opening ceremony. So will be the same place. Thank you.
At what time? Constantine. Esto se celebra en otro lado. At what time is the cocktail? 20.
A las 8. Perfecto.
English.